Shares of Swiss pharma giant Novartis falling today after reporting earnings. The drug maker saying the second quarter sales were impacted by a drop in treatments and doctor visits. Novartis cutting its sales outlook, pointing to an extremely disruptive environment prompted by the pandemic. I sat down with the CEO of Novartis, Vas Narasimhan, asked about that environment and whether he'd seen any countries stockpiling and preparing medicines for what doctors are warning is a second wave in the fall.
Well, so far, in terms of the medicines, we've not seen strong stocking activity thus far in quarter two and quarter three. We saw it towards the end of quarter one. Now I think healthcare systems have gotten to a more stable situation. So we're not kind of in the same position as personal protective equipment where you are seeing a lot of volatility. We think we've gotten to a reasonable steady state in terms of our ability to supply hospitals. The one area where I think we'll have to keep watching out is ICU medicines. There was a run for certain months on ICU medicines. That's now stabilized. I'm hopeful that doesn't happen again. And if there was kind of stockpiling of critical ICU medicines, that would be an area of concern because there's limited global capacity for those medicines.
What about the treatment that you've been looking into? We saw some pretty positive results in late May from one of your anti-inflammatory drugs, I think, for severe patients of COVID-19. Are there any follow-up studies, any more information that you can tell us about that?
So our approach is to take a broad-based approach to therapeutics. One, we have our Sandoz portfolio, as I mentioned. We're making that available broadly, which includes medicines that have already proven effective, like dexamethasone. We have two pivotal studies ongoing, one with a drug called canakinumab, another a drug called ruxolitinib. Both of them now are enrolling, almost completed enrollment, and we hope to have readouts in Q3, maybe early Q4. Those are, I think, promising medicines where early-stage clinical data suggested in hospitals in Europe where they could have had an important role for hospitalized patients. And then we have now over 20 medicines and over 34 clinical trials elsewhere in our portfolio that are being evaluated by physicians around the world. And we'll start to see that data come through as well in the coming months. Lastly, our research unit is really focused on finding a pan-coronavirus drug that we hope can be used in this current pandemic and perhaps in future pandemics. We have a few candidates. We hope to get them into the clinic in the first part of next year. So we're doing everything we can to really support the global response.
And then there's hydroxychloroquine, which unfortunately has been politicized so much in this country. It's hard to follow the back and forth on the studies on this one. What's your latest thinking about the efficacy of this drug in fighting COVID-19?
Yeah, as you know, there's, I think, over 90 studies either ongoing or reading out on hydroxychloroquine. I think right now the emerging consensus is that it may only have a limited role in certain settings. We continue to make it available whenever a government requests it of us. But I think I think it looks like there's only going to be a limited number of circumstances where it may have a role. There are some important studies ongoing, a large-scale study in the UK looking at its use very early in hospitalization, a few other studies as well, which I think could help inform the decisions. It is worth noting there are some countries around the world that actually have hydroxychloroquine as part of their standard treatment protocols. So I think it's important we get all the best data, and then we'll make a final informed decision on the use of the medicine.
You've got a pretty unique vantage point across countries, and as a physician, how do you evaluate, what's your opinion of the U.S. response to fighting COVID-19 versus, say, the Europeans?
You know, I think when you look at any epidemiological curve and exponential growth, the key is early intervention to really break transmission cycles. We know that from outbreaks. We know that from past pandemics. I think in Europe, you saw a very concerted, forceful effort very early to get the numbers down, sort of smash the curve and get it down as aggressively as possible. And that reduces overall transmission dynamics. And I think here in Europe, you've seen consistency in the use of social distancing, masks where appropriate, as well as very good tracking of any cases and contact tracing. I think in the U.S., because of the nature of the U.S. public health system, I think you've seen a lot more variability in how different states have taken on COVID. And I think because of that, you see more variability in terms of the caseload. So, I think the key is consistency and early action whenever you have these kinds of exponentially growing outbreaks.
Obviously, we are going into election season in this country. Politico is actually reporting today that the White House is looking at reviving some drug proposal executive orders, including the rebate plan. What are your expectations as far as what legislation, if any, will actually happen with the country still fighting a pandemic at the same time?
Yeah, I think from a legislative standpoint, with each passing day, the likelihood of legislative action is declining. Obviously, executive actions could happen, but executive actions have to happen within the remit of existing law. And depending on the executive action, I expect there would be a lot of debate and actions from various players in the industry, depending on which executive actions are taken. I take more of a midterm view on this. I think what we're going to see is a reset probably at the end of this year, depending on the elections, depending on the makeup of the Senate and the House, as to what then are the policy priorities, where does drug pricing fit in those policy priorities, and then what is the agenda that's going forward. Our hope as an industry is that the focus will be on patient out-of-pockets, reducing patient out-of-pockets, giving patients access to medicine, a thoughtful formulary redesign for the long term, and not kind of a patchwork of actions that may not lead to a thoughtful overall system. But we'll see. I think the one thing we've learned in the recent years is to be ready for anything, and we are, of course, prepared for all the different eventualities.
Should people have to pay for COVID treatments and vaccines?
I think across the industry, there's been a commitment to really ensure that the medicines are made available sustainably. We have every intention of making our medicines available at cost. I mean, we're not here to develop COVID medicines and try to profit from them. Our goal is to really support the global pandemic. We, of course, need our costs to be covered. But beyond that, we're not looking for any significant financial returns. I think other manufacturers, including some of the vaccine manufacturers, have committed similarly. So I think our industry is trying to do the right things for the global response and really committing to say this is about production, access, science. This is not the moment to be thinking about taking profits.